How often do you hear someone complaining about their arthritis? Now, people talk about arthritis as if it's a single disease, but it's actually an umbrella term for many different conditions. You have septic arthritis, rheumatoid arthritis, osteoarthritis, the list goes on and on. But let's start by looking at the root cause of all arthritis.
Arthritis is a condition that by definition means that there is inflammation, there is sometimes redness and warmth coming from a particular joint. When you then do an X-ray on that particular joint, you might see that the cartilage is worn away and that the bones are touching each other and rubbing against each other. And that is, by definition, arthritis. It is a wearing away of cartilage.
Well, our body is tough, so it must take a pretty long time for our cartilage to wear down so far that our joints begin to rub together, right? Not quite.
If you look at my waiting room, you would see that there are patients of all ages. Arthritis can happen in little children. We call that juvenile rheumatoid arthritis. And arthritis actually is much more common in people in their 30s and 40s, particularly the rheumatoid arthritis type of arthritis.
Arthritis affects 46 million Americans. That's 1 in 5 adults and includes 300,000 children. In fact, it's the nation's leading cause of disability for anyone over age 15. So what can you do to prevent arthritis? Or if you have it, what can you do to keep it from worsening? Well, how about changing your diet?
But for the most part, there really isn't a definite connection between diet and arthritis. I think a healthy diet is good all around, and that's really what I recommend for my patients to follow.
Now, some dietitians believe that certain foods can be inflammatory to your joints. And while that's still a matter of debate, certainly no one will debate that too much food can create a problem: obesity. Stress on your joints is bad for arthritis, and reducing your body weight can make a big difference. It can decrease knee osteoarthritis symptoms by up to 30%. Now, supplements are also helpful. Calcium and vitamin D help build strong bones and keep your body from breaking down cartilage.
In terms of calcium and vitamin D supplements, what I recommend is usually for postmenopausal women, 1,500 milligrams of calcium a day, which can come from food or can come from supplements, and vitamin D, specifically vitamin D3, also called cholecalciferol. And that type of vitamin D is best for the absorption of calcium and ultimately for keeping the bones healthy.
Glucosamine is another supplement that can do wonders for your arthritis, as it helps maintain connective tissue like cartilage. But there is some controversy. Some studies show that glucosamine greatly decreases arthritic pain, while other studies suggest that it may not help at all.
I tell patients, try it. I tell them to take 1,500 milligrams of glucosamine with chondroitin, without chondroitin, probably doesn't matter very much, but to take it religiously for about 3 months. If at the end of 3 months, they don't really see a difference, their hands are not any less stiff, their knees are still painful and stiff, you stop it because it's not for you. If on the other hand, you feel that you are moving your hands a little bit better, you're able to get around a little bit better, then glucosamine is for you and you stay on it.
And just out of curiosity, can those arthritic pains really predict the weather?
A lot of people do tell me that when the weather is going to get bad, their arthritis gets worse.
So the next time it's sunny outside and your Nana tells you to grab a raincoat just because her knees are creaking, you might want to listen. I'm Dr. Keller Wortham, and you're watching the eHealth Network.